So I heard what you were saying. Is there anything else that bothers your back?
Sometimes squatting, but not really always.
Okay. Is there anything that relieves it?
It's like, so it's not like a sharp pain. It always just feels like super tight, where it's like, it literally feels like someone's like, has like a vice around my back, where it's like someone feels like they're squeezing it.
Okay.
It's not like sharp, like pinching
So like
pain.
pressure.
Yeah, so sometimes I'll like foam roll it, or I'll take a cross ball, roll it out, and that like helps, but like, it hasn't like, yeah.
Okay. Any numbness, tingling, weird sensation in your legs? No. No weakness. No like other discomfort. It stays in your back and extends to your hip.
Yeah, like my hips, my lower back, and like the middle of my back, like here. This is like my normal standing posture.
Yeah, just comfortable.
What are you looking for?
Like scat positioning?
Yeah, so he's a little bit like depressed in his right scat.
Mm-hmm.
And no like scoliosis or anything as a kid, right?
Not that I know of.
You look a little bit rotated through your thoracic spine.
Which way?
This way.
Okay. Whoa, like just dives right in.
Yeah.
Gotcha. I
Like
feel.
like far.
Oh my god.
So going back like 5 years ago, maybe 6 years ago, I worked at a gym for like 4 years. And then like I hurt my back bad. Like I was always super hard-headed and never went to a doctor. But I think I herniated a disc because I tried like picking up like a half rack, not even like a squat rack like that, like a big half rack by myself. And that time, like, so like when I'm deadlifting, obviously I'm like form conscious. But if someone says like, pick this off the ground, like you should pick it up. I wasn't like conscious of form.
Okay. Now when you did that, did you get any pain down your leg or was it all in your back?
For a little bit, like.
It went into your leg,
Yeah.
one side?
Yeah, my left side.
Your left side. And did it feel worse to sit?
So it didn't feel like, again, it wasn't like sharp pain at the time either, but it felt like almost I had to, if I sat for too long like this, especially because I was always on the computer,
Yeah.
I felt like if I got up, I was like stuck like here. Like I couldn't like get out of it.
Okay. Was there ever any like moment where you noticed that your hamstrings felt super tight after that?
Just when I'm lifting, but like not ever like.
But like when you deadlift, do you notice that sometimes your hamstrings feel super tight?
Yeah, I'd say so.
Okay. So stand up, take your split, and then stand on one foot. Like all the way up. With this hand, with your right hand, I want you to reach back and try to touch the back of try to touch your knee on your other side. Like extend and turn. Lean back. Yeah. Come back up. Does that hurt? No? Other side. Does that hurt? No. Okay. Look out that way. Do a regular squat.
So I squat wide. I'm usually here, so.
That's fine. If you bring one knee all the way up to your chest, he gets straight, but he does not reverse.
Yeah.
Come back down, other side. So we can get him out of his tilt, but he has to bring his knee all the way up to his chest. So come down.
Yeah, you saw when he was squatting.
Mm-hmm. Now, range of motion. So just lean forward like you're going to touch your toes. So he gets all his motion from his thoracic spine, right? Because there's nothing here. This is still, he's
Just still sucking
still in lordosis.
I'm so shocked I can touch my toes right now. I never really can.
Come on up, and then put your hands on your hips and lean backwards. For days, extension for days. Come up.
Yo, that's crazy.
No pain, right?
No.
Good. Arms by your side, lean over to the right. Can you come up? Can you go to the right without leaning back towards me? So like go straight over. Yeah. Okay, and up. And lean to your left. Good. And come up. So you're saying that he has no motion right here? Okay. So he gets it all from above. So I notice right here, stay still. So now I want you to cross your arms across your chest. Keep your hips where they are and rotate to the right. Yeah, so still, that stayed completely still, right? So what you should see it's a combined, it's a coupled motion, right?
Right.
In the lumbar spine, you should get rotation and side bend should couple, but he's uncoupled, right? Because he's not side bending with rotation. So now rotate left.
Yeah, nothing.
Nothing, maybe a little bit here, and then come back. Good, and then relax. And then, I don't know if you can see from there, but like he's got like bowstringing, right, of these paraspinals, even when he's resting.
Oh, you can feel
Yeah.
it right away.
Yeah. So if you relax, now if you go forward again, like you're gonna touch your toes. So they're still on,
You
right?
can see 'em still, yeah.
And then come back up.
My hamstrings feel tight there. They're supposed to.
Yeah, I mean, it's a stretch.
Wow, that's crazy.
I like to look at range of motion in standing, but also in sitting.
Sitting.
So lock his pelvis, right? Good. Fold forward, like one segment at a time, if that makes sense. Like kind of roll down, exactly. And go as far as you feel like you can.
Feel all there.
He's flexing now, but he wasn't before. But he still is pretty locked up here. And then come up. Do you feel any pressure there?
Not really.
Okay.
I feel more like here
Yes. Okay.
than like in the middle there.
Okay. Rotate to your right. Little rotation. Come up. And the other side. A little better
Yeah, it's
sitting,
better on our
actually.
side,
And come up, come to center. Good. And then arch your back, like lean back. Yeah. So much
Wow, that's
motion.
crazy.
Come on up. Good. Good. Oh, he moves pretty well on his left. Come on up. So that was the only time I saw you move, like through here. Good, and relax.
What are you testing for?
Come back. Don't let me move you. Trunk strength.
Okay.
Seeing in 3 different positions allows you to get a little more feedback from his tissue here. Arms up. Good. Don't let me move you. Pull down. Good. And pain. No.
We're looking for that one.
Flexion.
Just flexion. Okay.
Your lumbar paraspinals. But we just tested his lumbar paraspinals in a million positions and he had no pain.
Fine, yeah.
Except when they were stretched. So when they were stretched and you had to push up into my hand, you had some discomfort. But that was at that inflection, which you don't live in flexion. So for you to move into that position is probably abnormal. So that's why it was uncomfortable. But I think that sometimes that's one of those really easy diagnoses that people are like, oh, you strained muscles in your back. But you didn't, because I've
Just like the combat
tested the
muscles.
crap out of your back, right?
Yeah.
Muscularly. I think it's more, so now we have, it could be joint, it could be ligament, it could be disc, like all those things are still in play. But muscle is pretty much ruled out, because if you had just a muscle strain, every position I put you in and
Would
tested the
maybe.
muscle would hurt.
Yeah.
Like column. You tender in here.
No.
So like his paraspinals here versus his paraspinals up here. So if you feel how much like further up these are, right? You can feel almost like you
Yeah.
can feel like the different fibers that are just like kind of springy.
Just bring it. Yeah,
Yeah.
exactly.
So because he has fairly significant curves, right? Like lordosis and kyphosis are both pretty exaggerated. Not that that's bad. I mean, kyphosis and lordosis are normal terms. I think what happens is those get turned into like pathology, but they're not. His just seemed to be a little probably excessive. Do you have any pain there?
So now of all times is when I feel like a little bit. But
Just because I have you on your stomach? Like if you lay on your stomach, does that bother it?
No, like when I'm stomach's fine, but when you were like, stretching it like that, like, that's when I feel like
So when you're out.
I don't like it a little bit more than anything.
Yeah, you feel like pressure there.
Yeah.
Okay. So I'm gonna pull you. Any pain?
No.
Did he has motion there or he doesn't?
He has motion. He's hypermobile
Or
at his TL.
Oh, really?
So like
Well, because he moves there
this
more
is
than he moves there.
gooey.
Yeah.
Really?
So start here and then go to like here and you'll feel a significant difference. I mean, his ribs end, so also that's part of that is normal. But I think he's hyper.
You said he mainly moves here anyway, right? Yeah. Like all of his movements there. There's like almost none.
And there's none up here, right?
Little.
Little.
Up here, yeah.
Some. Do you feel how much more give there is at his CL? So he's hypermobile into extension
Gotcha.
at his junction. I would be interested in seeing if he is hypermobile into any other or if he's hypomobile, right? Because I can't address, hypermobility is strengthening
Right.
to fix that. But hypomobility is where we can address it with manual. So lay on your side. So I want to see if how his motion is into, so that was extension,
Right.
segmentally.
Yeah.
And then I want to see side bend and rotation and flexion. By rotating their legs, you can look at segmental side bend.
Yeah.
Yeah,
And
he's
L4,
also a
L5.
little bit,
Single side bending.
yeah, not really side bending. See, like, what is his hip motion like? Is he super stiff there? Then it's literally every other one is the problem, right? So
Yeah. So you're expecting it to be what, hypomobile then?
I think he gets pain because he has like instability or hypermobility. So probably that old injury left him with a little like excess motion. A little stiff.
This feel, yeah, I feel it in
Do
my
you
hips.
feel
a
that
lot.
in your back or in your hip?
In my hip only.
I'm just gonna treat in powerlifting.
Yes. I'm a power lifter. Don't I look like one?
Yeah.
I think you need to work on segmental flexion. So you need to learn how to flex your spine. You're gonna hold, you're gonna sit up. So just in this position, you already have to use a lot of core.
Yeah.
Right? And try, bend your knees enough your spine can be straight up. And so now you're going to one segment at a time, lower. So, but you're going to like make your back come in contact with the mat the entire time. So first I'm gonna roll my butt underneath, and then I wanna touch one segment, and then the next one, and the next one, and the next one. Right. And then the reverse on the way up. So you hold, my back is touching my butt.
I've never done anything like this before.
And my butt is up.
Okay.
So now, yep, roll, tuck your butt under, try to make each segment touch the mat.
So just you have to learn how to use
learn
like
to
segmental,
flex.
yeah, or flex in general.
Yeah.
Because he has like no.
Because he extends everything, yeah. Good. And then up the reverse. So start to bend forward, then forward, touch the back, touch your back to the mat. Yes, good. Keep going all the way up.
So like having, I'm so used to being like that.
I know.
Here.
I'm not letting you do that. I know. And you'll shake a little, and that's fine. So come on up. Good. The hardest part is going to be like right here. So you want to try to keep that part of your back in contact with the mat until you're upright. Get irritated because when you're in an extended position, your joints are closed essentially. So if you can't open sometimes and get out of that habit posture, you continually have compression in your back, and that's why it feels like a vice, right? Or it feels like compressed because it is.
How do I make him like applicable to, like today I know I'm going to deadlift afterwards. Like, do I need to brace more and like focus more on my core? Like, should I be doing anything different?
Form is just, form is everything, right?
Yeah.
So before you lift, I would do some like activation exercises like this, and then working on mobility, but in the directions that you're limited, right? So you don't need to work on, like some people need to work on extension and like getting a long spine. You already have that. You need to work on like control.
So only like things I've done really, I think I've been extension. Like I do like the press ups
Yeah,
into
don't do
like
that.
again,
You
that's
don't need
what I'm doing.
that. Nope. You need like the reverse. So
Opposite of
like for you, I would even recommend like instead of doing stuff like that, do stuff like this. Where you're working on like rounding at your low back. Tuck your butt under.
Yeah, tuck that tailbone
There you go.
down there.
Okay, so before I was more like rounding like my back to do it.
Don't use, and that's the other thing. When you tuck your butt under, you want to like knit your ribs and your pelvis towards each other. Yep.
So it's almost like bring your ribs down.
From like, it's like a crunch, you know.
So like, this is what you're
Like a
in
standing
originally,
crunch.
and you want to be
But don't let your shoulders come forward.
Yeah.
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 Yes.
It feels so like not
You want to work
normal.
on being able to be there.
So that's pretty much it. It's almost like trying to decrease that space in between. Wow, so you have a ton back there.
Yeah,
Like not until everyone
I
I'm
could
like,
fit in
"Whoa."
there.
Probably.
What's
It's a little hypermobile at his TL junction where his thoracic spine meets his lumbar spine. And again, a little hypermobile at L5S1, so base of his spine. And then he was a little bit stiff kind of in between there in like his middle lumbar. So we taught him some segmental flexion mobility strengthening exercise and then some deep core recruitment.
Yeah.
And he's pretty good.
So stuff I should be doing like in the gym or like whatever.
Pretty much,
that,
yeah, all that thing. And try to do before you start doing
The
your
two of those, like the leg over, leg back, and I gotta hope we have a strap like that at the gym.
Yeah,